Every year, 57,000 Australians have a heart attack, and the number that should stop you dead in your tracks, nearly half of them happen to people who had absolutely no idea anything was wrong. No chest pain, no dramatic warning. They were going about their day, grabbing something from the shops, watching telly, waking up in the morning. And then it happened. Here is what most people are never told clearly enough. In the majority of cardiac events, the body sends out a specific set of warning signals in the days and weeks before the attack. Not hours, days, sometimes a full month in advance. The problem is nobody ever taught you what those signals actually look like, and they almost never look the way the movies taught you to expect. If you want medical information explained in plain English, no drama, no beating around the bush, hit subscribe and tap like right now. It helps this channel reach more people who genuinely need this information. Before we go through the warning signs, I need you to understand one thing. A heart attack is not an explosion that comes out of nowhere. It is the final step of a process that has been building inside your arteries, quietly, invisibly, for years. The walls of your coronary arteries, the vessels that feed your heart muscle, have been gradually accumulating deposits of cholesterol, calcium, and inflammatory cells. That buildup forms what we call a plaque, and when that plaque becomes unstable, when it cracks or ruptures, your blood rushes in to seal the break, forms a clot, and that clot blocks the artery entirely. The heart muscle on the other side of that blockage stops receiving oxygen, and within minutes it starts to die. That is what a heart attack actually is, not a dramatic Hollywood moment, a biological process with a long runway, and along that runway, your body leaves clues. Warning sign number 1, chest discomfort that comes and goes, and doesn't feel anything like what you'd expect. Most people are sitting around waiting for a crushing, vice-like chest pain, the classic Hollywood heart attack. That does happen. But in the weeks before a cardiac event, what people actually describe is something far quieter. A pressure, a heaviness, a tightness across the chest that feels like someone's plonked a heavy book right on your sternum. It might last 2 or 3 minutes, then it fades. You reckon it is indigestion. You think you've slept funny. You write it off as nothing. Here is the clinical detail that matters most. This discomfort is called angina, reduced blood flow to the heart muscle. And when it starts showing up at rest, not just during a bit of physical activity, that is called unstable angina. Unstable angina is classified as a cardiac emergency. It means the plaque is becoming unstable. The heart attack may be days or weeks away. If you've had pressure or heaviness in the chest at rest, even once, even briefly, that is a conversation with your GP, not next month. This week, warning sign number 2, fatigue that is completely out of proportion to what you are actually doing. This is the warning sign women miss most often, and it is also the one most likely to get brushed off by patients and sometimes by doctors as stress, a few bad nights kip, or just getting on in years. What people describe in the weeks before a heart attack is a very specific kind of exhaustion, not the tired you feel after a big day, something heavier, more all-consuming. Tasks that used to feel routine suddenly take enormous effort. Climbing 1 flight of stairs feels like 3. Getting dressed in the morning feels like a proper workout. You are having to sit down after things that never used to tire you out at all. Here is the mechanism behind it. When your coronary arteries are significantly narrowed, your heart has to work a lot harder to push blood through that restricted opening. It is compensating. Using reserves it was never designed to draw on continuously, and that compensation drains your entire system, your muscles, your brain, your energy, even when you are just sitting still on the couch. The key distinction: normal fatigue improves with rest. Cardiac fatigue doesn't fully resolve even after a solid night's sleep. If you are waking up just as tired as when you went to bed, consistently for weeks, that pattern deserves medical attention. Warning sign number 3, shortness of breath, doing absolutely nothing. You are sitting in a chair. You are lying in bed, you are having a quiet yarn with someone, and suddenly you feel like you can't get a full breath, like your lungs just aren't filling up properly. Most people blame anxiety, they blame their posture, they blame the aircon, and sometimes those things are spot on. But shortness of breath at rest, especially when it is new, when it comes in episodes, and when it is turning up alongside any of the other signs on this list, is a potential signal of early heart failure or severely reduced cardiac output. When the heart is struggling to pump efficiently, fluid can start to accumulate in and around the lungs. The medical term is pulmonary congestion, and the first symptom it produces is exactly this: a nagging, recurring sense that breathing is harder than it ought to be. One clinical detail worth knowing: if your breathlessness gets worse when you lie flat and eases up when you sit upright or prop yourself on an extra pillow, that is a very specific cardiac signal. Doctors call it orthopnea. It means fluid is shifting around in your chest based on gravity. That is not anxiety. That is your heart telling you something's not right. Warning sign number 4: pain that travels to places that seem to have absolutely nothing to do with your heart. This is the warning sign that sends people to the wrong specialist for weeks on end. They treat the jaw, they treat the shoulder, they treat the arm, and nobody connects it back to the ticker. Here is why this happens. Your heart shares nerve pathways with several other parts of your body. When the heart is under stress or not receiving enough blood, what we call ischemic pain signals travel along those shared pathways, and your brain gets the location completely wrong. Doctors call this referred pain, and in the weeks before a cardiac event, people frequently describe a dull, persistent ache in the left arm, sometimes the right. A tightness or soreness in the jaw that feels like a toothache with no obvious dental cause. A deep ache across the upper back or between the shoulder blades. The pattern that flags this as cardiac rather than a dodgy shoulder or a dental issue. It tends to appear or get worse with physical or emotional exertion and ease up with rest, and it comes without any clear local cause. No injury, no dental finding, no trigger whatsoever. If you've been dealing with unexplained jaw, arm, or upper back discomfort, especially if it comes and goes, bring that specific pattern to your doctor, not as separate complaints. As one connected picture. Warning sign number 5, sleep that suddenly falls apart, and night sweats that have no obvious hormonal explanation. Disrupted sleep in the weeks before a cardiac event is far more common than most people realize. People describe waking repeatedly through the night, not from pain, not needing the loo, just suddenly wide awake, with a vague sense of unease they can't quite put their finger on. And in some cases, particularly in women, this comes paired with episodes of sweating at night that are way out of proportion to the temperature in the room, not the hot flushes of menopause. A cold, clammy sweat, the kind that soaks through your pajamas and has no obvious trigger. Here is the mechanism behind it. When the heart is under prolonged stress, when cardiac output has dropped and the sympathetic nervous system is working overtime to compensate, it triggers the release of stress hormones, mainly adrenaline and cortisol, at completely the wrong hours. Those hormones disrupt your sleep architecture, specifically knocking out the deep restorative stages. They also activate your sweat glands. The result is broken sleep and cold sweats, not because of what is on your mind, but because your cardiovascular system is running in emergency mode at 3 in the morning. Warning sign number 6, swelling in your legs and ankles that you've been putting down to being on your feet too long. A bit of ankle swelling at the end of a long day, after hours standing around, is common and usually nothing to worry about. But swelling that is there first thing in the morning, swelling that doesn't go down overnight, swelling that has been progressively getting worse over days or weeks, that is a completely different conversation. When the heart isn't pumping efficiently, blood pressure in the veins rises. Fluid leaks out of the vessels and pools in the lowest points of the body, the ankles, the feet, the lower legs. The medical term is peripheral edema, and in the context of cardiac decline, it signals that your heart's pumping capacity has dropped enough that your venous system is backing up. Here is a simple test you can do right now. Press your finger firmly into the skin just above your ankle bone and hold for 5 seconds. If the indent stays, if the skin doesn't spring back straight away, that is called pitting edema. And pitting edema that is new, getting progressively worse, and showing up in both legs is a medical evaluation, not a compression sock situation. A proper medical evaluation. Warning sign number 7. A cough that just won't budge, with no cold, no allergy, no infection to explain it. This is the warning sign most people chalk up to everything except their heart. They try antihistamines. They swap out their pillows. They blame acid reflux. Here is what is actually going on in some cases. When the heart is struggling to pump forward efficiently, fluid builds up in the lungs, the same pulmonary congestion we talked about with breathlessness. That fluid irritates the airways, and your body's response to airway irritation is a cough. A cardiac cough tends to be dry or brings up white or slightly pink-tinged mucus. It is often worse when you are lying flat. It might come with a mild wheeze, and it doesn't respond to cough suppressants or antihistamines the way a regular respiratory cough does. If you've had a persistent, unexplained cough for more than 2 weeks alongside any other sign on this list, that combination needs a doctor, not a chemist. Now here is what changes the whole picture once you are past 50. Every one of these warning signs is more likely to be subtle in older adults. Not more dramatic, more subtle. After 50, your pain threshold shifts. Your nervous system's ability to flag distress becomes less reliable. The cardiac warning signs that would produce dramatic symptoms in a 35-year-old may produce only mild, easy-to-dismiss sensations in someone at 65. This is one reason heart attacks in older adults, and particularly in women, are more frequently described as silent or atypical, not because the heart isn't warning you, because the warning is quieter than you were taught to expect, and you need to be listening at a lower volume. How old are you right now? Drop it in the comments below. Because at 52, at 63, at 71, the threshold for taking these signs seriously should be getting lower with every year, not higher. So here is exactly what to do with this information. 1. Don't wait for crushing chest pain. That is not the only signal, and in many cases it is not the first one. The signs on this list can show up weeks before a cardiac event. Take them seriously at that level of subtlety. 2. If you are experiencing 2 or more of these signs at the same time, fatigue, breathlessness, leg swelling, chest discomfort, don't evaluate them separately. Bring them to your GP as a pattern. One connected picture. 3. Ask your doctor specifically about a resting ECG, a stress test if appropriate, and a coronary calcium score. These aren't exotic tests. They're standard tools for cardiac risk assessment, and many people over 50 have never had them done for. If at any point you experience sudden severe chest pain, pain radiating to the arm or jaw, sudden breathlessness, or you feel like something is seriously wrong, don't drive yourself. Call an ambulance immediately. Every minute of delay in a cardiac event costs heart muscle that does not grow back. Your heart has been talking to you for weeks, sometimes for months. Most people aren't listening because nobody taught them the language. Now you know what pressure in the chest at rest means, what cardiac fatigue actually feels like, what referred pain in the jaw is really saying, what a cough with no infection is telling you. These signs don't guarantee a heart attack is coming, but they are your body's clearest, most direct request for medical attention, and the cost of taking them seriously is one doctor's appointment. The cost of ignoring them can be everything. If this gave you something real, subscribe and leave a like. It helps Dr. Elara Whitefield reach more people who need clear, honest medical information. Share this with someone you care about. It could matter more than you think.